So it's gone on now for 2 months, whereby they've had insufficient measures in place. If they put the right things in place back in June, I suspect they'd be out of it now, but they didn't. And so now they continue to do half measures. I don't understand it. It's actually illogical. So if you're going to put a mask wearing requirement in place, put it in place. Don't only put it in for some LGA areas. It's just so frustrating to watch what they do. The New South Wales government does. They always put in place half measures. They don't go all the way. And with COVID, you need to go all the way. Look what Adelaide's done. They had Delta come in, they went all the way and they crushed and killed it, and now they're open again. Queensland did the same. We did the same. For some reason, New South Wales always takes half measures and it doesn't work. I don't know why they can't learn that lesson.
Is it time for the New South Wales Premier to resign?
I'm not going to suggest that.
At National Cabinet today, did the Prime Minister support your COVID-0 stance? And the plan going forward, how does the modelling now stack up given the New South Wales situation?
Look, I can't go into, they're two very good big questions, so I'll answer them as best I can. I can't go into what exactly different people said at National Cabinet, but obviously we all agreed to pull every lever we can to keep COVID as low as possible and keep the pressure on to suppress it as much as possible. Whether that is zero or close to zero is probably dependent upon the state that you're in. So I think we all accept that principle. When I say to people, as I've said now, the last 18 months, I'd prefer not to have COVID, I mean it. I prefer not to have COVID. I prefer Western Australia not to have COVID. And anyone who wants to argue that we should have COVID, I think they've got rocks in their head. So we're doing everything we can to keep our situation as it is, which is the safest, freest, most prosperous community of anywhere in Australia or anywhere in the world. And that's where I want to keep us. In relation to your second question. So, the modelling. So the modelling upon which the decisions over the last few weeks were based was based upon the Doherty report. And the Doherty report, if you go to page 13, the first paragraph, it says this. We assume, and this is what all the modelling is based upon, and I quote, we assume that a single outbreak involving 30 individuals initiates community transmission at the time of transition to phase B, 70% two-dose vaccination, once target vaccine coverage is achieved. As I said, 70% two-dose vaccination. That's the assumption underlying it. That's the assumption. So clearly, that's no longer the case. New South Wales has thousands of cases. Victoria has scores of cases. So clearly that's no longer the case. And you've also got to, under the modelling, assume that your contact tracing, your quarantining and other capacities are not overwhelmed. And obviously in New South Wales, they are overwhelmed. So therefore, two of the basic assumptions upon which the modelling was based are no longer in place, and potentially when states get to 70% two-dose vaccination won't be in place, most probably won't be in place. So we've all agreed that the Commonwealth, and certainly Commonwealth has already done this, they'll be reviewing the modelling, recalibrating the modelling, and that is something that will be ongoing now for some period of time.
So does that then mean that the national plan needs to be torn up, redrawn? Where do we stand on that national plan now?
Look, the plan remains the plan. We're not deviating from the plan, and we'll just see what the modelling comes out with over coming weeks.
When you talk about offering assistance from a hospital point of view to New South Wales, what does that involve? And I mean, does it leave it just in here that's already shown signs of struggling vulnerable?
Yeah, well, that's a very good question as well. Look, New South Wales at this point in time doesn't need extra doctors, nurses or health professionals or equipment from other states, but I think we need to get ready for that. It may well be that they do. Now, we're all Australians. We can't have people dying in car parks, in hospitals in Sydney or Newcastle or Wollongong or Broken Hill or Walgett or wherever it might be. We're all Australians. So if we need to provide support and assistance to New South Wales, that's what we'll do. And I think every state and territory would be the same. And if we got into that situation that New South Wales is in, I would hope the other states would do the same for us. So that's one of the things about being Australian. We help each other.